Trubenstein.
Good afternoon, Chair Colhorst and members of the committee. I'm
Michelle Dean, if you could pick that up and just move it a whole lot closer. I don't hear very well.
Is that better?
Yes,
okay.
ma'am.
I'm Michelle Trubenstein, Dean of Health Sciences at Blinn College, and it's an honor to speak to you all today regarding Blinn's health science programs and the challenges we face in meeting the state's growing need for healthcare workers. I'm proud to be joined today by Dr. Mary Hensley, Chancellor of the Blinn College District, who is in the audience. Blinn's Division of Health Sciences offers 2-year Associate of Applied Science degrees that prepare approximately 400 students each year for a wide range of healthcare careers, including dental hygiene, emergency medical services, nursing, physical therapy assistant, and radiologic and surgical technology. To assist currently employed students seeking to enter the nursing field, Blinn also offers degree pathways that allow these students to apply their previous experience and training toward that associate degree. Blinn also offers pathways to 4-year bachelor's nursing degrees with several universities. As Blinn strives to help Texas meet the statewide demand for skilled healthcare professionals, we face 3 key challenges. The first, like it's already been said, is the lack of available clinical space. Blinn is proud of its partnerships with Baylor Scott & White, CHI St. Joseph, and other medical facilities. However, with additional clinical partnerships, we could expand our capacity and increase our enrollment. Additionally, if the state legislature were to take a role in creating a statewide approach to increase clinical opportunities, they could have a significant impact and generate more influence than any single college could on its own. Our second challenge comes in hiring qualified faculty, as it's been noted several times. These highly skilled professionals are in high demand within their industry, and community colleges such as Blinn must compete with the private industry to recruit those qualified instructors. The third challenge is substantial investment in facilities and simulation equipment that is required to provide students with the hands-on training that they need. To help colleges compete for qualified healthcare instructors and access modern simulation equipment, we recommend additional state funding in the form of increased contact hour reimbursement for the health science courses or any other direct funding that might be there. Thank you again for your time today and for your continued support of the health sciences education.
Dean, can I, first of all, I want to give a shout out to Chancellor Hensley. Chancellor, great to see you. And former State Representative Leighton Schubert, who is Associate Chancellor at Blinn College. Good to see you back in the chambers on both sides, and welcome. I want to mention, I want to talk about clinical sites, and Dr. Weston, I would have mentioned it as well to you. We got off on another tangent, but let's talk about those clinical sites. And Dean, you mentioned, Trubenstein, that the state could help. Define that for us.
Well, just the acuity that some hospitals or LVN, ADN programs see, we don't get to go into those communities, those facilities like elsewhere. Luckily, we have a great relationship with Texas A&M and our facilities where we don't have to compete to go into those acute care areas as ADNs and LVNs. So we are allowed to do that. If there were something out there that didn't, or that helped to keep us from being limited or pushed out of the acute care facilities, it could help.
Well, how are you pushed out? Is it just the sheer number of rotations available?
Right, and you know, the LVN to RN group they're getting to do more and more, but the LVNs don't get to go into the acute settings as often because they don't actually work in that acute care setting. Things are changing, they're starting to shift. In the last few months, I've seen some of that change. But the LVN especially doesn't get to go into the acute setting. And then, like it's been mentioned, the nurses are tired, there's not as many out there, so there's just not as many slots to have. So helping alleviate that, the nursing shortage, which is the big thing here that we're working on, the more practitioners that we have in the facilities, the more slots that would become available. So it's a twofold problem. When we're short-staffed in the clinical facilities, it keeps us from being able to place students in those facilities as well.
And you define acute care as?
Is like your ICUs, your med-surg floors, anything semi-critical.
Do you have to have the acute care setting?
For the skills that are needed for our associate degree nursing, yes, we do.
So if we looked at other sites, like we mentioned, state hospitals, state supported living centers, do y'all utilize the state supported living center in Brenham at all?
The LVN students do, yes, ma'am.
Okay.
But the ADNs do not. The skills that are needed in those facilities aren't what is being taught at the associate degree level or at the baccalaureate level. They're more the basic skills.
Dean, clinical hours are set, as we learned, not by the nursing board, not by higher education coordinating board. They're set by you. So how do you determine how many hours are needed?
Well, over the years, we've developed what is needed to prove that we're developing a safe and prudent nurse, and we base what we continue to do for those hours on the time it takes to get that student to that point with their skill set.
I know I was reading in my many notes here, I think Blinn has a 100% pass rate on the test. I'm sorry, what's the name of the test?
The NCLEX we did last year, yes, ma'am.
Yeah, congratulations. I think you're one of 9 institutions in the state of Texas, so congratulations on that. Between now and the interim, I would love for this panel, I know we're going to continue on this panel, but to come up with some answers and defining those clinical sites, what that looks like. If the state can make a huge difference on that, let's look at that. But again, you've heard my interest or my potential ire in that I don't want to supplant programs. I want to open up the pipeline. And so I think there's a very critical balance that has to be considered in that. So we look forward to receiving some more of y'all's input as we prepare to do an interim report so that we can make recommendations